عليكم ورحمة الله وبركاته. Good evening, everybody. I welcome all of our colleagues attending this workshop about surveillance and e-notification from all institutions, government and private institution as well. I'm Bakhit Safrar, Head of Surveillance, Directorate of Prevention and Communicable Disease in DGHS, Salalah. This workshop, it is very important. We have also our colleague here, Dr. Vidya, epidemiologist, Mr. Muhammad Qabbari, Sanitary Inspector, he's Supervisor of Malaria, and Mr. Ahmed Al-Mashani, EBI National Program, and also Head of Non-Communicable Diseases. Also, we have our colleagues here from Public Health Program in Sharqiya University as trainers here. So my voice is clear, please. Hello?
Yeah, it's clear, Mr. Wahid.
Okay, thanks, Dr. Khalid. So as you know, the importance of the surveillance and the notification of communicable diseases. This is all our colleagues, the doctors, physicians from all institutions, private and government. You know the importance because here our public health action, it is starting after we get the notification. If any delay in the notification, our action it will late, and the main aim for our action to stop the spread of infection and screening the contacts and many procedures, and we are doing it according to the notification. Now the notification is very easy, just from click from your computer. It is e-notification, all of the communicable disease. Before it is very difficult. There is a manual form, and also we are waiting, and you're going to send it by post 2 days, 3 days from the Walayat, Shalim and Mazuna and Maqshan, maybe after 1 week only we are received the notification. So this is just an overview of the tarassud. Tarassud last maybe 2 months, 3 months, we have upgraded from Ministry of Health, upgraded the system, and upgraded also the servers for the tarassud. So there is some problem last period, 2 months, on tarassud. And it's in private institution. Now it's finished. The upgrade is finished, and now we are have our agenda in this day. It is the first lecture. It is with Dr. Vidya, epidemiologist. It is about surveillance, communicable disease. And the other one, it is about surveillance and status of malaria in Dufar. Mr. Muhammad Qabari. Then the e-notification in communicable disease with Dr. Vidya. Then we will open a discussion. If you have any doubt, any question, we will inshallah answer you. Now we will start with Dr. Vidya, please.
Thank you very much. Assalamu alaikum. And
slides clear.
Can you see the slides, please?
Now it disappears.
Can you see it now?
No, we can't see right now.
Okay, please, if you see it, just till it is clear.
Okay. Now we have this white slides.
Okay.
Can you see it?
Yes, we can see it.
Okay, thank you. Thank you very much. We'll go stepwise and we'll have, this is nothing new for us, but for new recruits, this is a new and some learning thing. And the repetition and revision for all present doctors and other staff, nurses and lab technicians. This will be like, revision. We don't have time to read and go back. I try to consolidate these things in a very, in 20 minutes, we'll try to finish this surveillance. But as rightly said by my head of department, Mr. Wahid, it is integrated with the tarassud, and tarassud is a powerful weapon now we have, and powerful battery that we have to use very effectively. So it's actually surveillance and tarassud. We have to be master of all these things. Presentation, this is first communicable disease surveillance, what notifications. Then some feedback I try to collect from 1st of January 2026. Then once again, we have to revise what is Group A, Group A syndromes, the classification of disease for the simplicity of notifiable disease. Then we'll come to some shortcomings and then how to solve these shortcomings. And we'll go ahead with other. Next, please. Surveillance. Everybody should have on tip of tongue the definition of surveillance. It's continuous, ongoing process. Even if we eradicate all diseases, still surveillance will go on because we have to search. And it's an ongoing, continuous process. What? Collecting information, then converting it into data. So data, sometimes ready-made data we get, we have to convert sometimes. Then classify and analyze the data, and then we take action. Some these activities, sometimes isolated, sometimes all together we do. Some rapidly, some in a systematic manner, on daily, timely, maybe weekly, on monthly, yearly, decade basis. And then we complete our surveillance cycle. What is that cycle? We have to detect the case, okay, according to case definition, which may not match with our medicine, surgery, other that we learn. This is epidemiological definition that we have to stick up for detection of any communicable disease case. Then we have to notify on tarassud as early as possible, and we have the categories for that. So then we have to collect some samples to prove. Without that, confirmation of the disease is not possible in almost all cases. So this knowledge is also important to go ahead. Not only notification, some doctors, new doctors, they notify a case of fever and rash, but they don't have that knowledge of what samples we need to collect and where to send. So this is also very important. So you see, this is cycle: detection, notification, laboratory, then laboratory gives our results, and in between we take public health action immediately. After 1 day, after 2 days, we do field epidemiological action and try to control the disease within normal limits, within endemic, or if it is eradication, then within one or no cases. Now, till disease no more becomes a public health problem. So this cycle goes on. I'm giving little more time on this because if one follows this, that detection according to the definition, then we have to notify timely and complete, then lab sample taken, result comes, in between public health action, it comes positive, then more intense action, and in this way we continuously run this cycle of surveillance and public health action and epidemiological action to control the disease in any region, country, whatever. Now we have two types of surveillance now. Everybody should even this indicator based. Please, previous one. Now this is called, new term has come, indicated based. Before what we said, surveillance. This is indicator based surveillance. What is it? It is routine collection, analysis, interpretation of the data from structured health, that is designated health facilities. Okay. Now we have in front of it, we have the others, where evidence is not required. Here we need evidence. There we require the event. So this is structured thing, that is non-structured thing. Even a municipality, even agriculture department, even the school can notify in the EBS. But IBS now combining with these two is the whole surveillance unit. Everybody should understand. This whole unit is combination of these two. Not only doctors and nurses and we medical staff are responsible, even the community should be responsible. Non-medical department should be responsible. They should understand the basics. So this is how the whole or integrated total health can be achieved. That is the aim of WHO and also of our ministry. Next. So grouping of diseases. I will tell you, everybody knows almost. If newcomers are there, please listen carefully. Then refer to your manual, which is online, present. Group A disease, Group B disease, Group C disease. Group A is a very high priority disease, should be notified immediately. It is said within 24 hours. No, it should be immediate. If you can sit here, right, become more comfortable. Okay. So if you list, don't read the list. See, keep this in brain. Cholera means one single case of cholera is outbreak. So please go through the definition. I'm not going to elaborate all definition. This is not possible. Yellow fever, plague, the new type of any influenza. Any type of new. We catch this in 2019 years old. See, this corona we catch. This is new type of influenza type, corona type of virus. Okay. Then I highlighted these 5, 6, 7, 8 because they are here common. We are getting Crimean Congo hemorrhagic fever. This is one type of hemorrhagic fever, followed by dengue fever. Then Haemophilus influenza type B invasive disease. This is it is invasive as well as it causes meningitis. Then we have meningococcal infection. There is meningococcal meningitis. They're highly infectious. They are, and their fatality rate is also high, and that's why we have to put them on as Group A. Besides this, any pulmonary TB is threat to the community, family. Then malaria, because we are on the verge of elimination of malaria. Rabies is a death sentence, everybody knows. If there is something like rabies, which fits in the definition, we have to put it in Group A, act immediately. And since last 1 year, we put this monkeypox. Now I think it is removed from there, but still if monkeypox suspect, we don't have any case, but we have to be reactive. Now these are the definitions. There are syndromes, means various symptoms come together. They're not disease, but this is syndrome pointing to some disease which is internationally important. Like acute flaccid paralysis, AFP, is for eradication of polio, which is an international drive. Only 2 countries in the world are now having, Pakistan, Afghanistan, which are near to us, not geographically, but communities. They are having frequent travel from these countries. Then we have fever and rash illness. This is for the measles and rubella. WHO pledged for eradication of measles and rubella. See, so many countries are free of this. Of course, new outbreaks are coming with variety of new measles virus. It happens during the phase of eradication. It comes to the end, new things will come, and we have to deal with them. Next disease, syndrome, is congenital rubella syndrome. We don't have any cases there. Then you see acute hemorrhagic fever syndrome. In that first 2-3, I just told about this. There may be other syndrome which is not mimicking with CCHF or dengue fever, and it is hemorrhagic fever syndrome. Then corona, MERS corona, this is common in not in our region. And then food poisoning in community region, major food poisoning is also group A syndrome. Next. Group B, I will read the list. Every case under this group should be notified within 1 week. We never wait for a week. Immediately we take action, but not as fast as what we do in group A. However, the best practice is to notify as early as possible and do the routine investigation. Next, please. See, the list is on your tip of your finger. See, viral hepatitis, acute, any jaundice and fever, typhoid fever. So if you suspect pertussis, that is whooping cough, we notify as, and then if classified as pertussis, then pertussis. Brucellosis is a very common here. It's a group B disease. Leishmaniasis, schistosoma, then HIV, mumps, varicella. Don't take, see, mumps nowadays we are taking samples and trying to classify it. Next year, maybe upgrading our surveillance, we have to take samples for varicella also. So it's a stepwise upgrading the system. Then encephalitis may be there, meningitis-like syndrome, various viruses can be there. Group C is a separate individual 7 categories in which C, national ARI surveillance. This is for influenza and related viruses, their circulation to know. Then acute gastroenteritis surveillance, diarrhea, dysentery. Then we have sexually transmitted infection. Then so on and so forth. Next, please. This I try to consolidate how many number of cases just confirmed and notified in our region since 2022 to 2026. AFP, yes, in 2020, we need at least 5, 6 is better. So last year we could achieve. This year we have 2 cases, enough. If we are completely vigilant, correct, as per definition, we'll get the cases, inshallah. In meningitis, this is NM means Nigeria meningitis, SP means the streptococcal pneumonia invasive disease, and HI means Haemophilus influenza. All these are meningitis cases. If you notify, see very carefully, Nigeria meningitis is under control, but one disease, that is Haemophilus influenza, is showing more trend. We are keeping very much watch on it. 5 cases till now, then we will keep very much watch on it, whether they are clustering or source, and then we'll go in detail. Otherwise, this is within normal limits. Fever and rash means we collect samples for measles and rubella. In last 2-3 years, we have 2-3 cases. All these are imported cases. This year we have 15 cases out of 18 notified, and 2-3 of them are imported from Yemen. 3-4 are almost all are imported, because one family came and it came positive for measles, and it was not vaccine. That's why you see this is 5 number, very big number looks. In CCHF, every year after the Eid al-Adha, before that also, in between also, we have 1 or 2 cases. This year we don't have any case, but in starting of year, because of tick bite, we got the cases in this year. Dengue fever, there was outbreak in 2000 and before. Now this year we have 4 cases. Brucellosis, this is endemic here. If you try to find more cases will be there. But our rate of notification is very good.
Continue.
Thank you. Rate of notification is very good, and we are having 116 cases this year. Next, please. So other hepatitis, it is within normal area. Whatever these 4 cases of hepatitis A, we are getting, it is importation from Yemen. We are dealing very successfully. Typhoid, no cases, but I am worried about this. The notification should be more. So please, suspected typhoid cases, so that we can test and clear that there is no typhoid if it comes negative. Pertussis, because chances of importation from Pakistan and India are very high. Pertussis, whooping cough notified and pertussis came positive. This is within normal, because in 2023 is 35 cases. This year we have 4 positive cases out of 20 notified, and there is no clustering of cases. Next, please. Now, I will try to focus on very important definitions that you can also go. All algorithms are displayed in your clinic. Please go through it. This is for polio detection. Okay. Anytime any virus comes, it causes paralysis in children below 15 years. What type of paralysis? It is a proximal paralysis. And floppy. Okay. Next, please. So what we have to do at primary healthcare level, don't do anything. We have to transfer the case to SQH, and in that 2 samples of the children will be collected. And you have to collect contact sampling. Next, please. Fever and rash, this is for detection of the cases of measles. So very clear definition. Non-vesicular means not like chickenpox, non-vesicular maculopapular rash with fever, test it for measles and rubella. That is the simple. Don't look at the age. Okay. Now this is samples to be collected in VTM. So always laboratory should have at least 1 or 2 viral transport media and nasopharyngeal swab. Urine and serum can be collected. It should be sent to CDC and then to CPHL. Next, please. This is hemorrhagic fever syndrome. I told you about this. If you have doubt, transfer the case to SQH. Don't collect the sample. This is highly infectious. At primary healthcare level, we are talking CCHF and all these septicemic meningococcal or all other things. You have to focus on hotline and transfer the case to SQH. This is the best policy. Don't go in collecting CCHF samples at your end. Food poisoning, so Kharif is coming. Everyone, I alert everyone. See, very clear definition, 2 or more person experience similar illness. What illness? Sudden onset of history of ingestion, pain in abdomen, loose motions, nausea, vomiting, and there should be multiple person involved from not from one family. Then it makes us the major outbreak. Otherwise, 1 or 2 cases from same family, we have to investigate definitely. But we have, it goes in category B. Category A means this is major public health problem. History of ingestion, common food, many cases coming in short period, similar sign and symptom. But if you have doubt like event like this, immediately pick up 93531812 and discuss the case. This is most important. Next, please. Viral hepatitis, I will request we have the cases. Next, please. Some issues and notification. So no notification, no sample collection. This is the best policy. But see, we are not here to according to our guideline, we have to notify. I will come in my next presentation on this. Next, please. Now, this is new thing coming, Ebola, but the Bundi Bio, it's called Bundi Bio. This is the district in Africa, in Uganda, and these cases are there in other parts. But this particular Ebola variant is causing problem in Uganda and the Congo. It may spread as told by WHO, so we are very much vigilant. So what is the strategy? Pick up the case definition of hemorrhagic fever. This is the hemorrhagic fever. And ask if it fits there, ask about travel history, ask about any contact with similar cases where the sign symptom of hemorrhagic fever, and discuss the case on hotline. That is the best policy. Next, please. So there are issues. I come to know that the trainings, that is CME, continuous medical education, can be conducted even for communicable disease. Tarassud or this, please do it at your level. This 1 year, 1 hour, once a month, I think mandatory for them. All these doctors, you can call us. Please call us for this. Then focal point at the healthcare institute must be, for surveillance, must be very active. Going through tarassud, updating our doctors and all these things that we are expecting. Communicable disease and syndrome classification, group B, all these algorithm classification should be ready with the new doctors and our current doctors on their table, or you can display on the wall also, if whatever possible. Next, please. So issues, notification of tarassud, different section, that I will come in my tarassud section. But very important, we don't have any EBS signal at your level. Suppose you are in Mirbat, you can communicate with schools and all these things. We need the EBS signals. Since last 5 months we don't have. So we'll discuss at the end whatever the things. Conclusion, I'm very happy. The team is very happy. Together we are doing very excellent work. Our department is very happy. What we have had in last year, before year, this year, we are improving. Alhamdulillah, we will keep our pace and we'll go together as a team. Thank you very much.
Thank you, Dr. Vidya, for your very nice presentation. Now I will invite my colleague, Mr. Muhammad Qabari. He is talking about the surveillance, status of malaria surveillance in Dhofar region and in the Oman. So please, Mr. Muhammad. كانك عادي.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, good evening, good afternoon to all.
واضح. slides واضحة.
Okay, first I am very glad to
لحظة يا محمد. slides واضحة. Excuse me.
واضحة محمد.
Okay, I am very glad to meet you to talk about this malaria in Sultanate Oman. First, we should have idea about this is history of malaria in Oman. I think mostly didn't know about that is Oman was endemic country. And I think this is best health program done from Ministry of Health. This is start 1991 to eradication malaria in Oman because the community is suffering from malaria, from all. And I think this is our slide. This is explain what is malaria in the world. This is Malaria World Day. This is okay. First, second, this is Dhofar map. This is explain. This is and share what is the challenge to us, because if you compare between this is the Oman citizen and this is severity also. This is more severity more means mostly livers coming from endemic country, and this endemic country maybe this carry the result and make infection to community. This is big challenge to us. This is malaria case detection. See, this is I think this is explained. This is one case coming, I think, from Ethiopia or Somalia, and he's suffering from malaria because this is, we led to discover his case. He reached to this case because this is the global impact of malaria. Okay, I think this is, we explain, this is number from WHO. Okay, this is new. Second, this is malaria in Oman. Now, I think we explain, this is when we start the malaria program, this is 1991. This is, I think, Oman population not like now. But if you compare between these malaria cases and this population, this is very high. So that we make this malaria eradication program to reduce malaria. Okay. This is also a strategy for a challenge. I think this is early detection, very important to control, to malaria control. We put some point we should follow. This is especially doctor should have information about which country this malaria spread, because this is mostly cases coming from this endemic country. Okay, doctor should have information about which country malaria spread and take care about this. And we put this malaria protocol, how this doctor early detection malaria cases when it's come in his clinic, and it is easy to know because this is malaria symptoms. Not everybody knows, and not this is first, but first from where he's coming. This is he got it malaria before. Travel history very important. This help us to move in the field also. Second, this is when we start malaria eradication in Oman. I think this is mostly knows. This is big important Ministry of Health also, and this is our team. This is follow malaria program in field also, and given this is advising to this is the field team. Okay. This Anopheles mosquitoes, female Anopheles mosquitoes, it is caused to transfer malaria from this is source to human. Okay, now what after eradication? Okay, Alhamdulillah, we did our best. All malaria team did their best to reach to Oman to succeed, and we are very nearest to get this malaria certificate that is Oman free of malaria. But this is not enough for us. I think malaria surrounded us, and we should know when we eradicated malaria, we not eradicated malaria only. We eradicated immunity from community. We should take care if malaria return back and the community free of malaria means it is very dangerous. That time we blame ourselves to eradicated malaria. Now we should have, very carefully to malaria eradication, malaria detected early. This is doctor should knows, because this big challenge. We will be happy to get this malaria certificate, but we still worry. We should be carefully. If malaria returns, it is very dangerous to community. Second, This is a malaria protocol. I think we gave to all health unit, private or government unit. The doctor should follow this protocol to early detection malaria, and that time he should inform us to follow this case. This screening is for malaria contact. This is also we're going to make a screening to know which source. Maybe we got the male source given infection to all, and also second cases we can got second case to and give treatment. This is statistic for this is malaria from 2023 up to 2026. Okay, that's the blame. Okay, this is notification anti-malaria drugs. This is doctor should know. We have two kind of malaria falciparum and malaria vivax. We advise malaria falciparum doctor should refer to hospital because this is we can start his main treatment because malaria falciparum need a specialist doctor to start with patient. Maybe he not start main treatment because the patient, I think, is case in danger. Mostly malaria coming from African and Yemen for state of malaria falciparum. If doctor and the laboratory given result that is malaria falciparum, doctor should transfer to Sultan Qaboos Hospital to follow. And Vivax case, this is treatment, this is available, and this is can doctor in health unit, government health unit can give him treatment. But if he feels that is this case serious, he can transfer to Sultan Qaboos Hospital. Okay, this is malaria treatment guideline. Okay, and with this is we sent to all health unit, government health unit. And I should give a big thank to our partner private clinic because mostly malaria cases coming from the private clinic. And they help us to continue in our succeed and eradication malaria. But this is treatment not available in private clinic or private pharmacy. Okay, this is policy of treatment of malaria. Okay, doctor, this is we sent all this is guideline to all government unit. And I think the doctor should follow and should know what is treatment can given to patient. Okay? I think, and also now we have this is the travel clinic. This is very important because I think many people can travel for tourists to Africa. He should know what is prophylaxis tablets he can go and he follow instruction from malaria travel. This also we sent. This is clinic travel. I think this medicine in all health unit. This is available. If we travel, any tourist want to go to endemic country, we should take care and take this is malaria prophylaxis tablets. Before and when we come back, we follow. Okay, this is explained. This when this is tourist going to endemic country, This compare these 125 million travels each year and 10,000 return by malaria if they going to endemic country. Okay, and this I thought this slide also explained, and the doctor should follow. Okay, I'll tell you. Risk of travel. This is advising to travels to follow this point. Okay, to protect himself. These prophylaxis tablets in the travel clinic available. Okay, this is a dose of prophylaxis. Okay, I think this is very clear. كده تمام.
موجودة في القاعدة.
ايوه اوكي. في حاجة ثانية؟ Okay, thank you to all.
Thank you, Mr. Muhammad Qabari, for a very important presentation. And this is the treatment parts for the medication. It is for the doctors, and it is available in the guideline of malaria guideline of Ministry of Health. So thank you. And now we will go to the last lecture. It is with Dr. Vidya about the unification communicable disease, identification of communicable disease. And after this lecture, we will open discussion. So please, Dr. Vidya.
Thank you very much. Let's, in very short, talk about some issues and solutions in tarassud. Now, this is very advanced versions are coming now. You know, as discussed by Mr. Wakil, we had some upgradation since 2 months in tarassud. Now it has become a powerful battery, so that even the locations and contacts, and even we can do automatic analysis in that. Then various indicators can be obtained. So I will discuss. This will be a continuous activity. Whatever I could find, I put it in words. Tarassud. Please. I think you can see this. Can you visualize? Can you see?
Yes, we can see.
Okay. Now, introduction. Tarassud is the official digital health platform launched by Ministry of Health, Sultanate of Oman, which functions as a central epidemiological investigation and public health tool used to report, notify, monitor infectious diseases across the country. Now, this was launched just, I think, before during the corona outbreak. What features are there? Case notification. It provides a safe, secure pathway for doctors and public and private hospitals, even non-medical institutes, to notify specific events or infectious diseases that are listed as notifiable directly to ministers, or any unusual events. Then health monitoring, yes, by putting the data inside and analyzing the features like monitoring the quarantine individual that we carried out during corona. Then even certification, analysis of risk, what for future risk, and contact list and reports and locations and all these things. See, if it's a weapon, powerful weapon, and it goes in AI way, the
Dr. Vidia, there is some issue with the voice. It is very flexible. There is some very unclear.
Hello, voice not clear.
It become metal voice. Vibration.
تأكدوا من الوصلات، ممكن الوصلات تكون مهزوزة.
صوت البنت كويس.
Dr. Vidya, we can't hear your voice.
Hello?
You can try to disconnect and reconnect again.
Hello?
آية بخيت بخيت صوتك واضح لكن صوت الدكتور فيديا مش واضح.
Hello? Hello? Hello?
مين بيتكلم؟
Okay. The next comes patient information, full information.
Now it become clear, yeah?
Okay, thank you. Then diagnosis, history, and outcome. Everything is important. Group, diseases, which name, onset date, signs, symptoms, exposure, past history. You will find what we studied during our MBBS and graduation. All these things we describe whenever we write a question on any of the disease. Say, if you want to describe pertussis, diagnosis, history, patient information, group, posum, certain are there, but onset, sign, incubation period, and all this is thing. This all goes in favor of protecting the community and the treatment protecting the patient. So community is also equally important. That is the importance of this surveillance and tarassud. travel history must be asked. Nowadays, we are like in Oman, in our region particularly, we don't have measles cases, but they are getting imported. So we have to catch as early as possible. Now, at different diseases as per incubation period, laboratory investigation, where to send, what to send. I give a simple example of fever and rash, where we have to, for PCR, we have to collect nasopharyngeal swab and urine sample that is to be sent to CPHL. And for serology, we have to collect the serum sample. So 3 samples in fever and rash case we have to collect. So this basic knowledge is there in the manual also, but we have to follow it. We are lacking in that. How much time period it takes for result? That is also important. See, for dengue fever PCR, it takes 7 to 8 days. So this common thing is not with our new GPs. This I want to make very clear. Go through the manual. It is all there. After declaration of the result, before. Then one slide before. We also updating outcome and remarks, but nobody is doing. So see, if you see the window of tarassud, can we go live? Then I will show you there. There is no remarks put by. It is for you. You are not putting remarks. I'm not talking of all. Outcomes are not there. Diseases are not classified. So because governorate work is below in there to finalize the disease, what happened, and classify the disease. But before that, we have to look particularly the focal person of tarassud at that unit should have access to the tarassud of that local unit and should update regularly. This is not happening in our majority of units. So I request for this that regularly update the, next please, sections in tarassud. The left side, whenever we open window, there are ARI, then followed by TB, malaria, communicable disease, HIV. And in that, 2 things are important. First line, that is notification and listing. 2 subsections are very important. If you click on that, everything will come out. So notify, like, in poisoning, but not food poisoning in poisoning. That we have observed a lot of time. Animal bite injury in the animal bite section. So cat bite, they are notifying as rabies in communicable disease. So mistake is okay, but the understanding what we look at when we look at the thing and see the name of doctor, we follow that. Did doctor never read the communicable disease manual? He is not aware of where to, what to. Then definitely he is not aware what samples to be collected. Where is the? So he is like. So that's why I advise you to conduct local CME on tarassud as early as possible, so that and request us, we will help you in that. Common issues, there is significant improvement, definitely. I will tell in last 1-2 years, very good improvement. And we need this improvement because we now are putting tarassud at advanced level, maybe AI level, before that. Timeliness, completeness, very important. So appreciations from all our department for your work. Keep up the work. So who are lagging behind, they have to come with us and let's go together. Next. Common issues, selection of cases. So follow the manual and algorithms. I personally sent all algorithms even to small units. Follow the algorithm, your problem will be solved. So is it looking like varicella, it is looking like fever or rash or what confusion? If not, call the hotline number and get clarified. Notification in tarassud, measles notified in communicable. Today I got notified, suspected measles. This is not acceptable. No? Measles means it should go as fever and rash illness, because there's a separate, as per WHO protocol, we made this separate good section for this. Food poisoning notified as poisoning. So how can I don't every day go for poisoning section and see is there any food poisoning? It's not possible. So food poisoning should come in communicable disease. Selection of group. Brucellosis when notified as group P. See, we open the window in which source, whether drinking raw milk of camel, goat, and all this open. Then second way opens below that if there is close contact with the animals. Now, what some doctors are doing, they are not notifying in group B. They open others in that unspecified brucellosis. In unspecified brucellosis, you will not open these two windows where you have to ask questions whether you drink or then give health advice. No question. So they are notifying it in others. Please don't notify brucellosis in other. Always in group B, because we have to give, while talking to the patient, we have to give health advice also. People listen to the doctor. Okay. Same in AFP. They will notify other polio likes, they will not notify it as AFP. If AFP, there are 4 questions they have to ask. Whether fever was there, and that indicates it looks like polio or doesn't look like polio. So please notify these cases in that. Don't search in others and escape from the. I will show you if time permits. Next. No updates. Once entered, class, they will never look at that. This is not one person activity. This is multiple person update the tarassud. The last portion we have to update at government level. So before that, if laboratory results, you have to, they release, they automatically update. Okay, now this facility is made, but make it positive and then change the status as confirmed. That is your job. Many of them doing in brucellosis, but many are not doing. So we are requesting those who are not doing, I'm in contact, continues with them, and we are making some arrangement. How to make it to be done. Otherwise, at other units, it is done, and we appreciate their work. Outcome as on treatment, they don't enter this. Discharged or patient still there, what outcome is there? Patient is referred, right remark. There is big space for remark, right remark. So it shows that if you open second time, third time, and because you have to open regularly till there is outcome of the patient. Okay, so each international week starts on Monday, ends on Sunday. This also some doctors, they don't know when starts, when ends. This is internationally. You are doctors, Baba. Internationally, this is agreed all over the world that every Monday the week starts, ends on Sunday. Means on next Monday we have to report to Muscat, and Tuesday Muscat has to report to Cairo, and from Thursday, the Cairo will report to Geneva. If this chain breaks, it is breaking here. If you don't finish your classification by Sunday, we are unable to put how many cases and how many. Otherwise, we keep on doing the whole day conversion, your work. So please update all these things before, on Sunday at least. National reporting, Monday. Okay, to complete the tarassud notification till governorate part comes. That is your responsibility. Please start doing it. Inshallah, we will finish that. We will be adapted and we will do it. Common issues, basic understanding of surveillance helps in tarassud. Okay, you understood this. Example, fever and rash, I have given AFP. Okay. Then also for new doctors, next please. For new doctors and new staff, you should have training plan for them. And you can share with us what is your training plan there. Sometimes we'll come to there. We cannot come to 50 units, but you can send the feedback. This many we present, and for 1 hour we discuss this issue, half an hour we discuss. We never come across this. So if there is no training, even an intelligent person will forget the simple things. Because this is, we have to redo and update our knowledge. Okay, next. Conclusion, significant improvement we appreciate, but we need some cases in typhoid and hepatitis. Notify listed cases timely, and all fields should be filled so that, and other talks I said during my presentation before that. So thank you for listening to my long lecture, and I thank you here also patiently listening to me. Let's go together and do the best this year. Thank you.
Thank you, Dr. Vidya, for your important presentation. Now I want to welcome Dr. Faisal Ababali, our Director of Disease Control and Prevention. He joined us now. And for conclusion also, now we are finished our lectures. We will open the discussion after a few minutes. Now the very important things for this lectures or workshops, it is to know the importance of the notification and the e-notification, the importance of the notification on time, and also because our public health action, comes after the notification only. And also the importance of completing all data in the tarassud also notification. Importance of know about malaria, and now in Oman we are in the way for eradication malaria from Oman, and inshallah we will get a certificate from WHO soon. And the importance also of the travel history of all suspected cases, and that patient come from each country, because we have countries endemic of malaria, measles. We have a border, we have challenge for Yemen. We have expatriates came from Pakistan, India, and these all, most of these countries, they have communicable disease, and the challenge we have also more expatriate in our region. So our message today, in between of your hard work, we know, and we thank you, and go and through the guidelines, through the manuals of communicable disease. That's my all. I want to thank you to join us today. And Dr. Faisal, you have anything?
شكرا. Thank you, Mr. Bahid. Assalamu alaikum wa rahmatullah. Thank you first for attending this presentation. I was having another meeting, and we'd like to thank the speakers for arranging this meeting and this lecture. And I hope that now you got